2 days before I posted this question and many people answered as well. So this is a classical case of dumping syndrome. Please note that dumping syndrome is a previous year topic. So we will discuss this first. So this person has undergone Billroth 1 gastric reconstruction. What is this? This is stomach, this is duodenum. You have removed some part of the stomach and you have stitched both of it. This part is what? Gastroduodenal anastomosis. Okay, please note that you have resected the pylorus also. Pylorus भी reject कर दिया गया है. So in normal person like you and me, what? We have a stomach which is good. Right? This stomach has a reservoir function. It can store the food and it can churn it. We have a pylorus. It functions like a gatekeeper and decreases the gastric emptying. But in this poor fellow, whatever food he will eat, it will directly dump into the duodenum because he do not have a what? Pylorus, and also the capacity of the stomach is reduced. So this poor fellow is what? Very hungry. So he ate a full plate of biryani. Some people said that drinking fermented rice water is good for gut. So he drank it also. He ate a dry biryani. He drank rice water. Now what? All the hyperosmolar content is in the stomach. And now everything will be emptying into the duodenum. So in the bowel, it will attract a lot of fluid from the outside, and that's why the person will be complaining of nausea, vomiting and epigastric discomfort, and this is classical of early dumping. Now the glucose which is present here in the intestine will get reabsorbed into the circulation. So blood glucose will rise. Now this will result in insulin spike. Insulin will do what? Utilize the glucose, will result in the uptake of glucose via the GLUT4 receptors. Where they are present? They are present in the heart, in the adipose tissue, in the skeletal muscle. Remember these as has. Okay, blood glucose will decrease and this will result in what? Rebound hypoglycemia, and this will stimulate the sympathetic nervous system, and so there will be tremor, there will be palpitation and sweating because of SNS stimulation, and this is classical of what? Late dumping syndrome. Okay, so let's differentiate now between early and late. Early dumping, that is rapid influx of fluid in the intestine due to hyperosmolar content. Yes, this will result in what? Epigastric fullness, nausea and vomiting. This will worsen with more food obviously, and it starts in 15 to 20 minutes after the food. Now, what is late dumping? Late dumping will occur because of rebound hypoglycemia due to insulin release, and because of this hypoglycemia there will be symptoms like tremor, sweating and palpitation. This improves with more food but worsens with exercise, and this occurs 30 to 40 minutes after the food. So how will you prevent this case? You will ask this patient to take small and frequent meals, because when less food will enter, less dumping. Avoid liquid with meals. खाते खाते पानी नहीं पीना है because liquids empty very rapidly. Avoid sugar rich liquid, avoid simple sugar because these are reabsorbed very fast, and take high protein as well as high fat diet because they empty slowly. Okay, in resistant cases what you will give? You will give octreotide subcutaneously, but if there is no response with this also, then you can prefer Roux and Y surgery. So what is this octreotide? This is a somatostatin analog. Okay, this is a synthetic peptide. Now this will decrease gastric emptying, this will decrease gastrin release, this will decrease insulin, this will actually decrease the splanchnic blood flow as well. This is a whole lot of different topic. Okay, so now come back to the question.